Welcome. Let's talk about medicinal treatment of different types of diarrhea. Managements of acute diarrhea. Dietary changes. Identify and avoid trigger foods like lactose, gluten. Next one, hydration. Ensure adequate fluid intake to prevent dehydration. Next one, medication review. Evaluate current medications to identify that may contribute to diarrhea. Next one, consult a healthcare provider. For persistent or severe cases, consider testing for malabsorption syndrome or food allergies. Next one, laboratory test used for identification of diarrhea. First one, stool test. Consider test for pathogen if the diarrhea is severe, prolonged or associated with blood or fever. Next one, blood test or electrolyte panel to assess for dehydration or infection. Next one, medicinal treatment for diarrhea. General treatments. General treatments is started with ORS. Take 200 ml of ORS after each stool if patient is not vomiting. If fluid intake is not possible or inadequate or patient is vomiting, start IV fluids. Next one, IV fluids. Ringer lactate RL can be given 4 to 5 liters in 3 to 4 hours depending upon the condition of the patient. If urine output is adequate, continue fluid accordingly. If still no urine output, give 1 liter of normal saline rapidly. If no urine output after 5 hours, consider ARF. Antiemetics. If patient is vomiting, use ondansetron 4 mg. IV or orally 2 times or 3 times per day. Next one, antidiarrheal or antisecretory drugs and antimotility drugs. Do not use antidiarrheal if patient have fever, bloody stool, abdominal distension. Antimotility drug loperamide 4 mg tablet. Start with 2 tablet, 8 mg start and 4 mg after each stool to maximum of 5 tablet per day. Or you can use Resicadotril 100 mg tablet 3 times per day or 2 times per day. Next one, probiotics. It helps to maintain normal flora and reduce the diarrhea. Bifilac or Vibact capsule or sachet once per day. Or you can use Providac 2 capsule 2 times per day orally. Empirical treatment for diarrhea. Empirical antibiotic treatment involves starting antibiotics based on clinical judgment and the most likely pathogens, often before specific lab results are available. The choice of antibiotics depend upon the suspected infection, the patient's medical history and local resistance patterns. Check stool microbiology studies or stool culture. If pathogen found, use appropriate antibiotics. If not found any pathogen, use empirical antibiotic treatments with quinolone antibiotic. Example like ciprofloxacin, ofloxacin. Empirical treatments also be considered for suspected giardiasis or amoebiasis with metronidazole or tinidazole or ornidazole. Metronidazole may induce membranous colitis. Fidaxomicin also used for the treatment of diarrhea. Quinolone antibiotic ciprofloxacin is the best choice for E. coli, Shigella, Salmonella. Important points. Most acute infective diarrhea are self-limiting, no need of antibiotic. But use antibiotic if patients with septic illness like fever 39 degrees Celsius or more, or mucus or blood in stool, or extremely young patients or old patients, or malignancy or heart valve problems. Common cause of acute watery diarrhea is rotavirus. Antibiotic should be given in patient with shigellosis, traveler diarrhea, enterocolitis, cholera, and parasitic disease. Diarrhea with blood or mucus. Do stool culture and sensitivity and stool microscopy for ova and cyst. Sensitivity for bacteria and ova cyst for parasites. It is used for the identification of organism. In bacillary dysentery, fever and vomiting is present. In amoebic dysentery, fever is present and vomiting usually absent. In amoebiasis, re-examine stool after 4 weeks of initial treatments. Do not combine antimicrobials and metronidazole unnecessarily because mixed diarrhea is rare. Antidiarrheal should not be used when abdominal distension develops, particularly with ulcerative colitis and pseudomembranous colitis. Probiotics like lactobacilli, yogurt or curd have sufficient number of viable microorganisms. It may help to decrease amount and duration of diarrhea. Next one, treatment of mild to moderate diarrhea. Less than 4 stools per day with no symptoms or minimal symptoms. Treat with fluids, lactose-free diet and antidiarrheal drugs. 1. Severe diarrhea. Greater than 4 stools per day, fever, pus or blood in stool, abdominal pain, severe dehydration. Check for recent travel history. In case of severe diarrhea, may be infected with E. coli, Salmonella, Shigella, Clostridium difficile, Entamoeba histolytica and other. Antibiotic is the choice of medicine. Next one, treatments of acute watery diarrhea. First one, traveler's diarrhea. It may be infected with E. coli, Campylobacter, Yersinia, Salmonella, Vibrio. Ciprofloxacin is the choice of antibiotic, 500 mg orally or IV 2 times for 5 days. Or you can use doxycycline 100 mg orally or IV. Other choice is Bactrim DS, Sepmax orally 2 times for 5 days. Bactrim DS contain trimethoprim and sulfamethoxazole. Next one, treatments of colitis or Clostridium difficile colitis diarrhea or membranous colitis. Rifaximin 400 mg orally 3 times for 10 days. Other choice is vancomycin 250 to 500 mg orally 4 times per day for 7 days. Other choice is nitazoxanide 500 mg orally 2 times for 7 to 10 days. Important points: discontinue antibiotic with high Clostridium difficile potential. Example, ciprofloxacin, clindamycin, beta-lactamase, except ceftriaxone. Treatment failure common with metronidazole and vancomycin. If no improvement, do CT abdomen. Check for Clostridium difficile. Stool PCR can confirm the diagnosis. Next one, treatment of cytomegalovirus colitis. Valganciclovir 900 mg 2 times orally for 21 days. Next one, antibiotic drugs used for the treatments of typhoid fever: moxifloxacin, levofloxacin, ciprofloxacin, Bactrim DS, chloramphenicol, third generation cephalosporins, azithromycin. Treatments of cholera: doxycycline 300 mg immediately orally and doxycycline 100 mg 2 times for 3 days. Or you can use tetracycline 500 mg 4 times per day. Next one, treatments of chronic diarrhea. First one, treatments of Giardia lambelia: tinidazole or secnidazole 2 gram single dose orally, or you can use ornidazole 1.5 gram single dose orally. Otherwise, you can use metronidazole 400 mg for 3 times for 5 days. Other choices are nitazoxanide 500 mg 2 times for 3 days and albendazole once daily for 5 days. Next one, treatments of cryptosporidia: nitazoxanide 500 mg 2 times for 5 days. Next one, treatments of isospora or cyclospora: Bactrim DS 2 times for 10 days. It means trimethoprim and sulfamethoxazole. Next one, treatments of acute dysentery. First one, Entamoeba histolica. In case of amoebiasis or liver abscesses, tab tinidazole 1 gram 2 times for 3 days or metronidazole 800 mg 3 times for 10 days, followed by either iodoquinol 650 mg 3 times for 20 days or paromomycin 500 mg 3 times for 3 days. Next one, dysentery with Shigella. It is also called bacillary dysentery: ciprofloxacin or ofloxacin tab or IV for 3 days, or Bactrim DS, trimethoprim or sulfamethoxazole. It is a combination of drug, 2 times for 3 days, or azithromycin 500 mg once daily for 5 days. Next one, treatment of food poisoning may be due to Clostridium perfringens, Staphylococcus aureus, Bacillus cereus. No need to treat with antibiotics. Food infection with Salmonella, Vibrio cholerae, Yersinia, Campylobacter often need antibiotic treatments. Thank you for watching.